Our next presenter is Leah Gunther. Leah is winner of the university's first ever 3-minute thesis competition held last year. And those of you, if you can spare time, on 25th next week, there would be second 3-minute thesis. And in that competition, each student who is doing master's or PhD is to present their thesis in 3 minutes. And you get to hear really, really cool things. And what you would hear is from the 9 top students who have gone through the heats, similar to Olympics, many, many heats. And they have been selected now to present it publicly. And that's happening on 25th evening. So if you can fit in your schedule, I encourage you to do so. Leah completed her Master's of Science in 2013. She is also an EIT, engineer in training, and is currently employed at the Orthopedic Innovation Center as a biomedical engineering specialist and project manager. Her Saturday talk is titled, "When Your Hip Is Not Cool." Leah?
Well, good morning. I notice most of you are on this side of the room. So, again, my name is Leah Gunther, and I am a biomedical engineer at the Orthopedic Innovation Center, which is actually here in Winnipeg. And I didn't always want to be a biomedical engineer. In fact, when I was in your shoes, I wanted to go into medicine and be a doctor because I really liked the science behind it, and I also really wanted to help people. So in my first year of university, I started taking courses that would take me on the path towards medicine. But then towards the end of my first year, I decided to change my course completely, and I transferred to the Department of Biosystems Engineering, where the coursework and the design work really gave me a passion for biomedical engineering. So in 2010, I graduated with my bachelor's in engineering, and I got a job in the agricultural and environmental industry. And as much as I loved the work and the people that I worked with, I knew that my passions lay elsewhere. So in 2011, I went back to the U of M, and I did my master's in mechanical engineering, specializing in orthopedic product development testing. So today, I'm going to talk about the orthopedic industry, specifically about total joint replacements. And I'm going to talk very briefly about the research that I did and also what Winnipeg has to offer to this really innovative industry. So there's going to be a lot of asking for shows of hands. So how many people here know someone with either a hip or a knee replacement, maybe a shoulder, elbow? Okay, a good chunk of you. Now keep your hands raised. Keep your hands raised. Awesome. Okay. So now, how many of those people are under the age of 100? Yeah. What? Okay, and how many of those people are under the age of 60? Okay, some hands went down. And under the age of 40? All right, okay, this is getting interesting. And under the age of 20? No one? Okay, so in case some of you didn't get a chance to see the spread of hands, a lot of patients who are getting joint replacements are either beyond the age of 40 or under 100. So that's typically what you would see in the industry now, but times are starting to change. And what we're starting to see is something a little bit weird. On the slide above me, you can see that there are 3 main factors that are affecting the demand for joint replacements today, and that's age, your physical build, and your activity level. So what we're seeing now is that a lot of patients who are getting joint replacements today are younger, 20% heavier, and more physically active than patients who are getting joint replacements a few decades ago. So what you would typically see is a patient would go to his or her doctor with symptoms of osteoarthritis, and he'd be like, hey, I know that my joint is pretty much done, so I know I have another 20 to 30 years left of life in me, so I would like to get a joint replacement. Sure, no problem, right? Okay, quiz time. How long do joint replacements last in the body? And you can just shout your answers to me. Did someone say E? Oh, B? Okay, well, if any of you fell for the E, which is until the apocalypse is upon us, no. The answer is actually C, 15 years. Yeah, who got that right? Awesome. Okay, So to put that into perspective for you, if you get a joint replacement at the age of 40, by the time you're 55, you're going to need another joint replacement. So that kind of sucks. So that means you're going to have to get another surgery, which is pretty invasive, and you're also at a higher risk of infection during that surgery and afterwards. And you're also kind of putting a heavy burden on the healthcare system, never mind how much pain you're going to be in. So why don't joint replacements last longer? And we can answer this question by looking at erasers, for example. So let's say you're taking a math exam and you make a mistake. You take out your handy old eraser and you start erasing away. And you create eraser dust. And the more you erase, the more dust you create. And over time, your eraser starts to wear down. So the same thing can be said for joint replacements, specifically for metal and plastic joint replacements. Now, metal and plastic are the materials that are most commonly used in joint replacements today because they're biocompatible, so they get along really well with your body, and they also do a really good job of mimicking the natural joint. The problem lies is when you have your hard surface, the hard metal surface, interacting with the softer plastic surface, and that starts to create these tiny little plastic particles in your body, which gets dispersed through the joint. Now, this is where your immune system starts to kick in because they see these foreign particles and they start to react. But they don't react in the way that we expect. You see, the immune system starts causing the bones surrounding your joint replacement to resorb or to become less dense. And when that happens, your joint replacement gets looser, and that starts to really affect the performance of your joint replacement over time. And that's why we're seeing a lot of failures in joint replacements because of this wearing of the plastic component. So how can we make joint replacements last longer? And the very obvious reason is to make better materials and to create better designs. But how do we do this? So this is where the orthopedic industry comes in. A lot of orthopedic companies develop new materials all the time, and when they do this, they test them first in material screening tests. And that kind of gives them sort of an inkling as to whether there's potential that this material will be better than previous materials used in other joint placements. If those materials pass that initial test, those materials get manufactured into actual joint replacement components, and they get tested in these machines called joint simulators, which are basically exactly what the name says. They simulate the joint movement and also conditions in the body. Now, you're probably wondering why we're not testing in humans, and of course, that's where ethics comes in. You can't test in humans because of ethical issues. But the problem is that it's also really difficult to mimic the conditions in the body, especially in these machines that we're using. So this is where my research comes in. My research looks at how we can improve how we test artificial joints before they're put onto the market. And we can do that by improving or being more accurate in how we mimic the body conditions in our machines. So one of the factors that I looked at was being able to replicate synovial fluid. Now, for those of you who don't know what synovial fluid is, it's basically the WD-40 of our joints. It really helps our joints move effortlessly and painlessly together so that we don't have to worry about being stiff-legged like in all those commercials with the leave and whatnot. So the problem with using synovial fluid in our machines is, again, ethical issues because humans need this in order for their joints to function. So the orthopedic industry had to develop a synthetic lubricant, basically, to try and mimic synovial fluid. Now, that's all great and dandy and everything, but when I came to my research, I was able to take samples of synovial fluid from patients and analyze it in terms of composition. And what I found was that the synthetic lubricant was actually pretty different from actual synovial fluid. And one of the culprits is actually proteins, and we kind of heard about proteins in the previous talk. Well, proteins here, I'm not sure if you are familiar with the word enthalpy, maybe in chemistry or biology. For those of you who aren't familiar with the term, it's basically, in this case, how much energy it takes to degrade a protein. Now, for synovial fluid proteins, it takes about 1,400 kilojoules, which is pretty high. But the proteins that are in the synthetic lubricant it's a little bit different story. It's about half that amount. So because you need less energy to degrade these proteins, you're going to have more protein degradation. And the problem with these degraded proteins is that they affect our test accuracy. So when we're testing these joint replacements, these degraded proteins get caught between your metal and your plastic component, and they can either make it wear out more or wear out less. So how can you find out what's actually happening? So the big picture of the research is basically if we can improve how we test artificial joints today, that we can take that information that we obtained from those previous tests and create better materials and better designs for joints that will hopefully last more than 15 years and ultimately the rest of your life. So what does Winnipeg have to offer? Well, I work at the Orthopedic Innovation Center, and the really cool thing about our group is that we're not only a group of biomedical engineers, because that'd be extremely nerdy, we also get to interact with orthopedic surgeons, clinical researchers, and we also get to interact with academic researchers here at the U of M. So when we approach a research problem, we are able to do it in a more global perspective, because trust me, engineers don't know everything. So we also have a really cool database. It's called a retrieval database. So when a joint replacement fails, it gets taken out by the orthopedic surgeon and sent to us for processing and storage. So when we do these product development analyses for failure, we can pull some of these implants out, whether it's from the same manufacturer, the same design, the same materials, and really look and analyze as to why they failed, because sometimes it can get a little bit iffy. We can sometimes match patient information to see if there's maybe a patient trend that's causing these failures, or we can take a look at the actual material at a microscopic level and determine, hey, this is the material that's failing and this is why. The other really cool stuff that we have is a scanning electron microscope. And this allows us to zoom in onto the surface of the joint replacement to determine what's happening at the surface of these materials and to see whether a new material is actually doing what it's supposed to be doing. We also have, for those of you who are really into computer programming, we have an engineer that is able to model these joint replacements so that we can see how these joint replacements will react under certain conditions. We also have 3D printing capability, so maybe one day we can 3D print some customized implants. And also we have other technology that allows us to reverse engineer how joint replacements fail. And of course, we have an orthopedic suite for those of us who are planning on being orthopedic surgeons. We can actually hone our skills in this simulated environment, but not necessarily on live human beings. So I'm going to stop there just for the sake of time, but we do other research as well, and if you would like to hear more about it, feel free to ask. I'd be more than happy to talk very quickly about that. But before I end it off there, I want to leave you with a quote. What we find will change who we become. And I hope you can find some encouragement in that as you pursue either university or other adventures. Always be willing to continually learn, because what you learn will change your perspective not only on yourself, but also on the world. And that's really important for what you pursue later in the future. Thanks.
I probably can't speak as loudly as Leah can. The one thing I forgot to mention was we do have time for some questions, and Leah has already opened that floor for encouraging to ask questions. Dr. Katini is also here if you had a question on the first presentation. And before I open the floor for the questions, I just want to make sure you are aware, University of Manitoba has Manitoba Materials Institute, and that institute is focused on looking for the properties of the material, the development of the material, testing of the material for applications in wide range of fields, including construction industry, aerospace industry, or transportation industry in general, medical field, as an example mentioned by Leah, including they're looking at the materials for retinas, for enamels, for the teeth. So a lot of work get done in the materials area, and if that's the area interests you, certainly I would encourage you to get in touch with the Manitoba Materials Institute. So floor is open for a couple of questions to Leah or Dr. Katini.
Before I take questions, if any of you are interested, I did bring some samples of joint replacements with me. They're all different kinds, so you can come up and take a look. But if you do come take a look, please don't take them out of the plastic bags, because we want to keep those components clean, and we also want to keep your hands clean. So you can feel free to come up and take a look and ask questions if you want.
Okay. Any questions? Don't be shy. That's certainly in the schools you don't have being shy. Yeah, go ahead. Dr. Katini?
Fiberglass prototype. The plan is about 22 to 23, and the reason is that the duplication is different between human and non-human, and so there are a family of about, say, 22 human. The thing about NGF-16, out of all of them, it's the only one that's art-specific, art-observed. So that's
Any other questions? No? Seeing none, thank you very much, Leah. Give you a token of our appreciation.
Thank you very
Thank you
much.
very much.